Everyone, my name is Hrishikesh Amravatkar. I am the CEO and co-founder of DoctorQuickly. First of all, I'd like to thank Aksar, John, and SV Health for giving us this opportunity to present DoctorQuickly. And let me start with the slides. So DoctorQuickly is doctors in your pocket.
Can't hear you.
Can you hear me?
Oh yeah.
Oh. So we all know like current healthcare system is broken. Let me start with my personal experience. My wife and I are expecting a baby, so as you know, there are always some kind of problems that happens. So my wife started having stomach pain one night, and as paranoid as I am, I wanted to talk to someone or try to find out what's going on with her. So I went to like Google, WebMD, and all that stuff, like as we all go, and trying to find out some solution, and I was ending up into a worst case solution. And then I tried calling a nurse. Basically, it was a long wait. I ended up driving to the ER. And after waiting for 4 long hours, I figured out that the doctor, she just diagnosed saying that she just needs to take some rest and some Advil. So I ended up losing the whole night and even the subsequent day, trying to get an answer. And the whole agonizing pain of 4 hours and the whole night of what's happening with my wife was another problem that I had. So that's where DoctorQuickly came in as an idea. So these are the key main points of healthcare right now. It's inaccessible, it's not affordable, and it's very slow. When you need a doctor, you don't have a doctor, especially on off hours. And when your doctors are there, you have to take a long line for appointments, wait there, everything, what's going on there. Then it's expensive, you have to take day off from your work and all that stuff. And also it's very slow because of all the things that I mentioned. So with DoctorQuickly is the step 1 for solving all these problems with current healthcare. The solution has 3 fundamental pillars. We want to create a simple, quick, and affordable way for you to talk to a doctor right away when you really need them. DoctorQuickly is a mobile-first approach to make a video or audio consultation with your doctor using your smartphone device when you really need them 24/7. And we also provide on-hours and off-hours consultation. And we also plan to make sure that healthcare becomes as affordable as possible, so that hospital services are used only for people who really need them. So I would like to quickly announce that we launched DoctorQuickly just 2 days ago over the weekend. And we have got pretty rave reviews from everyone, and even investors, and even from various healthcare providers and physicians. And the iPhone app is DoctorQuickly. Please go on the App Store and feel free to download the app. It's a very easy app. Any patient with an insurance and without an insurance can join freely on the app. And it's also open for doctors who are on private practice or who are working for a healthcare provider, but they want to make some extra income on off-hours consultation. For example, if you are a patient, you can simply log in using your Facebook account. There is no subscription fee. It's free to join. And you can look for example, I'm looking for a pediatrician. So I look for the category for pediatrician. And I would be able to see all the certified doctors which we have approved in your area who have license to practice and give you consultations. Once you figure out who you need to talk, we will give them information like his experience, his license, his language, all the information that you need to talk to a doctor. And let's say you decide you want to talk to a doctor, you enter your symptoms, allergies, your photographs. We are a HIPAA compliant platform. And then within a click of a button, we allow you to make a video call, audio, or a VoIP call with the doctor. And this is how you see the video call in the screenshot. And once the call is done, we generate a receipt for you. We are a pay-as-you-go platform. You don't need a subscription. You pay per minute of whatever charge the doctor has listed per minute for. And once the call is done, you also have an easy way to provide feedback for the experience that you have. So there is an end of the loop also that we provide. And this is the screenshot of the doctor's side, how the doctor feels when he receives a call. So it's a pretty seamless approach. Everything is software. We don't have any hardware. So we have a driver on the software on the doctor's laptop, or also we have solution on the doctor's cell phone. So a doctor receives an email notification when a patient tries to call with all the patient data, especially with his follow-up consultation with that patient. And looking at all the patient data, then doctor decides to accept the phone call, audio call, or a video call with the doctor. And on his laptop, using his laptop, for example, he can do a video consultation with the patient. And right after the consultation is done, doctor gets the, basically we immediately make sure that the payment transaction happens to the doctor's account. based on the consultation and amount of time. This is the roadmap for DoctorQuickly. I and my partner Steven, we have been working on DoctorQuickly for a year now, and so we launched 2 days ago, and that's one of the key achievements that we did, especially in healthcare. Tech healthcare is pretty tough to break the market. And then our plan is to also use the standalone application as a validation point for proving. For our next strategy is to make it as a platform which can be plug and play. So healthcare providers can directly, we will provide white label services to healthcare providers out here in Bay Area where we can do a B2B business model with the healthcare providers, and they can use our solution for their private networks and their private patients. So as the market validation, we all know that almost 59% people or 60% already use emails, messaging with your doctors for any kind of consultations where your doctor gives you an answer like within 48 hours or something like that. So this is just the next step to email and messaging and providing video. Also, we have seen that surprisingly 70% of the consultations that happen right now where you go to a doctor's facility are for trivial use cases where you actually don't need to go there, by taking an appointment and basically being physically there. So that's one of the market we are trying to address here using telemedicine. The market size is huge. Globally, telemedicine is 14.2 billion. It's planned to be growing like 56% year over year, and especially with the Affordable Care Act, there has been a big push in US, especially from American Telemedicine Association, to bring telemedicine covered by insurance agencies. So it's going to be seeing more and more progress so far. It's coming forward. Our business model is pretty simple. With a standalone app, we have 30% consultation fee that we use, and we would also do white label services, as I mentioned. Marketing strategy, as I said, we'll be doing partnership with healthcare providers, with healthcare networks, and we will also provide referral services for doctors. And we are looking for healthcare experts. Anyone out here, this is the right forum for us who would like to join us as advisors. We are also looking for investment, and we are looking for healthcare networks who would like to partner with us, and especially new hires who are smart enough, especially having some domain knowledge in healthcare. And this is the team. It's a very small team, me and Steven. Myself, I have decade experience in tech, and I have graduated from USC. Steven Chow, who is the CTO and co-founder of DoctorQuickly, and he also has the same decade experience, and he's graduated from UC Davis. And that's DoctorQuickly. Thank you. Thank you.
Website or your company different from ZocDoc?
So there are many competitors right now, not as many as we anticipated. ZocDoc is mostly for scheduling of appointments right now. It's not for making a real life consultation with a doctor. It's more of an appointment scheduling tool so that you can schedule an appointment. We are a platform where you directly call a doctor, even if it's a day or a night, using your cell phone.
24/7 access?
Yes, 24/7.
What has been the doctor's reaction to this product? How do they like it compared to what they were doing before they are on the system?
So telemedicine has been there for a decade right now. So it's not something new. What we are trying to do is make it mainstream. So initially, doctors had some reluctance. Like for example, would they be willing to pick up a phone call at night, right? So why would they pick up a phone call? So now we have a solution, unique solution, where doctor can choose their pricing based on the time of the day. So if it's daytime, they can choose a price which is lower, and during nighttime, they can choose a price which is higher. Even and it's very easily customizable. On weekends, they can price differently. Yeah.
All right, last question.
So how many doctors are in the network?
So far, right now, since we launched just 2 days ago, we have some pilot doctors who are using this for their private practice. We are actually looking for more help for bringing in as many doctors as possible, especially in California. So we are expecting to, so far since we have launched, we have got some strong interest from like elderly services where they are using this private doctor network for providing it. So we will be bringing on doctors directly through their network on our platform.
Okay.
Thank you so much.
Thank you.